I'm going to call on Gabor and Jaeun and Brooke, actually, to come and join us up on the stage. This little segment, half hour that we're going to spend together, we've sort of loosely called it a fireside chat. But given what we've all gone through this morning together, it's even more appropriate. The fire part, there's been a lot of passion, compassion, a lot of blood pumping, a lot of breathing going on, and so it's just nice to be able to have our three special guests up on the stage. What we're going to do is invite you to ask questions. We won't have time for people to stand and tell their stories, but we really want to invite you to the microphones. If you have a question that you want to ask to Gabor or to Jaeun or to Brooke about their experiences and their ideas as we think about going forward. And I want to start exactly where Gabby left, which is this idea of making eye contact before you pass. Gabor.
So first of all, I'm going to remember that line because on my deathbed, I'm going to start staring at people. And they're going to say, "What the hell are you doing?" And I'm going to say, "Gabi told me to make eye contact before passing." That's the second point is that alliterating with eye contact is I. So making eye contact, where you actually, the real you makes contact with the other person. I want to make two quick other comments. The title of this conference, Care for the Vulnerable. Well, Gabi looked up the meaning of the word, what's the word that you looked up? Sorry?
Provoke.
Provoke, yeah. The meaning of the word vulnerability comes from the Latin vulnerare, to wound. And so vulnerability is our capacity to be wounded. And of course, as human beings, we're all vulnerable. But if there's a wound there already, you know what it's like when you have a wound and somebody touches you on it, it hurts a whole lot more. So the people that are really vulnerable are the ones that were wounded deeply already, and those wounds hadn't healed. And so when I talked about the power that we have, so imagine that a person whose first experience of authority figures was that the authority figures in their lives hurt them. And now you show up as an authority figure with lack of compassion or irritation or judgment or something. Guess what you're doing unwittingly? You're hitting on their worst, earliest wound. And so that the vulnerable get wounded again and again and again. And the third thing I wish I want to throw in there is that this vulnerability isn't just psychological. There's a study last year that showed that American black women, the more experience of racism they endure, the greater the risk of asthma. So the more racism, the more likely their lungs are to be inflamed and their airways constricted. Now we also know that the more stressed the parents are, the greater the risk of asthma in the children. Now how do we treat asthma? Those of you that have asthma or are physicians, we treat asthma by giving people stress hormones to open up the airways or to suppress the inflammation. In other words, this psychological vulnerability leads to a depletion of the immune system, of the stress system, and constriction of the airways. We know, somebody sent me a study this week that the more experience of sexism women experience at work, the greater the risk of physical disease. So this is a very serious conversation about how we get treated or how we treat each other.
Brooke, how are you doing?
Good. Thank you for asking. Yeah, I mean, to be totally honest, I was very nervous leading into today because it's the first time I've shared this much and this much in depth of that story, and especially a story that was, so secret for so long. And I kept that secret for my husband. And when he passed away, there was, the initial intense grieving period, and then I realized that it freed me from that, and I needed to really think deeply about how I wanted to use that and transform that pain into something. And I feel like that is really happened for me today. And I'm really, really pleased that I decided to come here and share it with all of you. I mean, I couldn't have asked for a more kind-hearted and open audience. And the whole sort of double sword of it being, this is my workplace and you guys are my colleagues too, and then mixing those two things, it's a little bit scary, but it feels like the right thing to do, and that I can trust every single one of you with that, not to judge me or stigmatize me. So, yeah, thank you.
Jaeun.
Yeah, and just as Brooke was talking, my thought was how wonderful it is that you can allow yourself to be vulnerable in that way, and to experience that vulnerability, and even just to demonstrate through your being here that allowing yourself to be human and vulnerable is not a bad thing.
Yeah, it feels really good.
And it's, because that's partly what we're talking about, is like we are the walking wounded, all of us as human beings in various degrees. And how can we admit those wounds and allow those wounds to actually become something through which something valuable can grow. And so thank you for doing that and for demonstrating that. I mean, it's like you've done more than just tell a story and get us thinking about a healthcare experience, but you've also shown us part of your own personal experience through it. And that requires some courage, so I admire you for that. Yeah.
Thank you.
One thing that is interesting, I was just saying to Bashir that the room feels a bit different this year, and he said, well, that's because this room is full of people who work with Fraser Health, not just in Fraser Health. People who are first responders, people who are community members, people who work with healthcare providers, caregivers, patients advocacy groups, all of you together invited into the room to be part of this web of compassion and care that's being provided in our communities. So the more that we get to know one another, so through Gabby's facilitation, through the questions and comments, the more that we can sort of see each other in each other. So this is all kind of part of a grand plan that Bashir, who you're going to meet in a few minutes, had as he was putting this together. So if we think about the system and budgets and human vulnerabilities, how do we move to a systemic approach to compassion so that each of us as individuals can be our best selves, but do so in a system that supports us to be that way? Gabor?
One of my spiritual teachers says that when there's lack of compassion, it always means that the heart has been shut down. Now, we think that we have to teach people to be compassionate. We have to teach kids to be compassionate. It's not like that. Human beings are by nature compassionate. Human nature is compassionate. Even rat nature is compassionate. If you study rats in a laboratory and they watch other rats being tortured, they get more stressed than if they're tortured themselves. You can measure their stress hormone levels. Because there's something about the mammalian nature that demands caregiving, otherwise mammals don't survive. So compassion is part of our nature. So the question is, what happens to it? So it's not a question of teaching it, it's a question of allowing it to unfold. What keeps it from unfolding is when you hurt yourself and then you shut down your heart to protect it defensively. So whenever you lack compassion, it's because there's a hurt there that you haven't dealt with. So when it comes to the system, it's not a question of how do you teach people compassion, how do you encourage compassion. It's a question of how do you train people so that when they're training, they're not just learning facts, but they're also learning how to deal with their own stuff, how to address their own wounds. And so when they do, as their heart heals, their heart naturally opens up. That's just what happens to people. And you know this yourself from your own experience, that the more healed you become, the more open-hearted and of service to others you become. So the question is then, how do we encourage self-reflection and self-healing, both in the education and in the ongoing experience of healthcare professionals? And the problem is that the way the system is set up, with all its demands and time expectations and all the paperwork, people have barely time to get their work done as is defined now. And you think, well, where am I going to find time for this inner or group facilitated inner work? My answer to that is, you'd find that if you did that, you'd free up all kinds of time, because people would be more present, more efficient, and much more effective at their work, so that they'd be saving time. But it's very hard to convince a system of that. Very hard to convince a system of that.
John?
Yeah, and I think just that it's important for us to talk about the fact that everyone experiences grief, everyone experiences loss, everyone experiences things, and that it's not wrong. And I think we have a tendency to pathologize negative emotions, and we do that very deeply. We have people who are experiencing grief, and I see this in the hospital. I have somebody
Can I
who's
interrupt you for a second? What is a negative emotion anyway?
well, yeah, the so-called, and I usually
Yeah,
put
okay.
that in front of it, and the so-called negative emotions, because they're just emotions. These are normal human responses and to very real situations that everyone goes through, and we are not exempt from that as healthcare providers. And I know I did a workshop a year or two ago for the home care nurses in rural southern Alberta, and we were talking about grief and loss and how these are nurses that go into people's homes and provide care for people who need care in the home. And so quite often they develop relationships with people over a period of months and years. And then when the person dies, the next day they're given a new folder and they go off to take on their new patient. And there's no acknowledgement of a need to grieve. There's no acknowledgement that grieving should even occur. It's like, you're a professional, you're not supposed to grieve. But it's like, we're all human beings before we're professionals, and humanity that underlies us as human beings who are working in these professions is not acknowledged. And so I think as a system, we have to stop pretending that we don't feel things in response to the situations that we're involved in, and that it's not wrong, and that sharing that with each other shouldn't be something that we're afraid to do because we're afraid of what are people going to think of us. So I think that's part of the systemic change that I think that we need, is to be able to acknowledge our humanity as individuals who are working in the systems.
Why was it so important to you, Brooke, to name the person in Burnaby who was so present there for your husband?
I think, because this shift towards a more compassionate healthcare system is going to start with those types of people being acknowledged and just being thanked. And, as both of you were speaking, I was reflecting on my own workplace experience where, we're a small group, we're a tight group, but there's still, I'll talk to my closest colleague about how there's this fear of speaking out of turn or speaking up for something that's different from what the group is up to. And your experience with, the man who lost his legs and being that outlier in the room when the whole room is feels like, okay, we're going with this approach, we're going to do this jovial bro thing where, we don't feel emotions, we just make jokes about them. And to the fear that's associated with stepping out and saying something different or speaking your mind is so deep and so ingrained. And we learn that as we go through life and experience judgment and experience that, sort of everybody looking at you and no one really knowing how to respond to what you're saying or feeling confronted or affronted by it. And it's funny, we were just talking at the table too about things we learn from our kids, right? Because we're teaching them, but they're teaching us. And I've got 2 5-year-olds and now a 4-year-old as well in my house. And it's seeing that immediacy with which they experience life. They're not afraid to speak their minds. They're not afraid to make mistakes. And how they've learned, even in the few short years, since starting school, I've seen a shift where they're looking at their peers and reflecting back and, thinking, oh, I shouldn't say this or I shouldn't do that. And it's a constant process to remind yourself, it's okay. There's nothing that your judgment against me can change about who I am and how I feel about myself. And that's something I'm constantly learning. And yeah, I've been that person who's afraid to speak up, but it takes practice.
Questions from our audience members. We have microphones here on either side of the room. If you have a question that you'd like to ask, please make your way to a microphone and we will try to get to you straight away. Are you heading up for a microphone? No? Okay. They're just on either side. Sir, there you go. So we're going to ask for questions.
Yeah, I had a question, and it's directed towards Dr. Maté and, of course, the rest of the panel to hear what he's saying. I'm very thankful that the truth of ACEs is being acknowledged and how we need to embrace and integrate it into how we see people and how we deliver care. But one of the concerns I've been having is that the evidence of ACEs is sort of awakening a response in many healthcare providers. And one of the responses has been to administer the ACEs questionnaire. And one of the things I am learning is that I'm just wondering about, is there any reason that we should have concern or caution about doing that? Because my experience has been is that we ask what are really quite intrusive questions and sometimes help people recognize that they maybe have more wounds than they recognized when they came in. But sometimes we haven't always earned the right to ask those questions, and quite frankly, I'm not sure if we're at a place yet where we know what to do with the response of that. And so what some people are telling me is they end up feeling more discouraged and more wounded as a result of that enterprise. So I'm just wondering is that if we're going to develop partnerships with people when we learn about the truth of their lives, that we need to do that with some caution.
Thank you for the question.
Yeah. First of all, the word intrusive is a charged way to use it. I mean, it's intrusive depending on how you ask it. So you have to make sure that you're asking these questions, but in a non-intrusive way. So it's a question you come alongside first and you say, well, there's a bunch of questions that I would like to ask you that may be painful for you, or may evoke some pain for you, but we have found over time that when people look at this material, they're actually encouraged and helped to get better. Are you willing to deal with possibly the discomfort of these questions? You don't just barge into it. So you don't intrude, and then the questions are not intrusive. That's the first point. The second point is, and just, was it last week? I think it was 2 weeks ago, I think now. 2 weeks ago, Friday, I was presenting in Orange County, California, with the chief investigator of the ACE studies, Dr. Vincent Felitti, who's a physician and internal medicine specialist in San Diego, California, with the Kaiser Permanente organization. And Vince and I are friends, and they've actually done this study. They found that when people come into the organization, the healthcare organization, and they're administered this questionnaire, just the filling out of the questionnaire cuts down on the number of medical visits they have to make. And you think, well, why on earth? It's because just being listened to is already a healing experience for people. And furthermore, when you ask these questions, what is the intention? You see, when somebody comes to you with mental illness, or say depression, or anxiety, or addictions, what is their state of being as a relation to themselves? They're full of shame that they're weak or flawed or morally derelict. When you can help them see that their depression or their anxiety or their addiction is actually, or their PTSD, is actually a normal response to abnormal experiences, you help to lift that shame. No, it's no longer about their failure. No, you're no longer asking, what's wrong with you? You're asking, what happened to you that made you this way, that made you function this way? So, I see no great risk. In fact, on the contrary, I see benefit just in asking these questions. And of course, I like the sensitivity in your question. I like the fact that you care about how you're asking it and what the impact will be. But if you do it in a non-intrusive fashion, it can only be positive. And the final comment I'll make in that is that if you're not comfortable asking these questions, don't. Because you're going to make the person uncomfortable. And so the discomfort that you think comes from them actually comes from you. You have to be quite fearless in receiving whatever response you get. If you're comfortable with their pain, they'll be comfortable with their pain. And if you're not comfortable with their pain, that's because you're not comfortable with your own. That means you got some more work to do. So don't do it until you're ready to do it. But don't make it about the client. It's about you.
We'll invite your questions. If you can make your way to the microphone so everyone can hear you. John, did you have something you wanted to add?
Well, yeah, I wanted to say, like, the point that the questioner brought up about, well, what do we do with the answers? And I think that's an important question to answer, and that the system has to be able, I think, to deal with what does come out of it. And it brought a patient to mind that I had worked with in acute care who was experiencing chronic pain and was hospitalized as a result, and had his early experience of having been brutally sexually assaulted by his father when he was a child was coming to the surface, and his regular coping mechanisms weren't available to him because of his pain that he was in. And I brought this to the attention. He wanted to talk to someone. He wanted to see a psychiatrist. So, and I brought this to the attention of the psychiatric evaluation team at the hospital, and they're like, no, we're not going to deal with that here. This isn't the time or place for it. He has to deal with that in the community, so we're not going to open that box. But the box was already opened, and yet there was nothing in our system outside of me as a spiritual care practitioner to actually be with that pain that that person had brought up. So I think our system needs to go, if we're going to have these conversations, which I believe we really, really do need to have, but we need to have a willingness in place to actually then cope with the issues that are brought forward. And I don't know if we're quite there yet.
In our school district, we offered the screening of the documentary duo Resilience and Paper Tigers, and we brought in Dr. Linda Ueda, who is a family physician who speaks to the ACEs study and some of the strategies that people can use to cope with some of the ACEs that they find that they recognize in themselves after taking the questionnaire. We had the same question as a district team. So she offered a resilience questionnaire so that she could highlight for people the protective factors that they have in their lives that will help mitigate some of those ACEs. So I just thought I'd share that piece.
Thank you.
So this morning I was really struck by Brooke's comment about having to keep her husband secret. You mentioned that a few times, and I've been on both ends of that as a physician, where people, after years of torment, had divulged their secret about some addiction, and also in the position of keeping a secret for those around me. And I think what I'd like to get reflections from the panel on is, how do we change that? How do we get past that? What do we need to do as individuals or as a society that we're not putting others in the position of having to keep that secret, because that in and of itself is a really challenging struggle that just makes the situation worse.
Thank you for the question. Brooke.
Yeah, it's a big question. I think there's so much involved with, in my particular case, why did I have to keep his secret? I mean, when he was working, there was implications like, he will lose his job, right? There's employment implications, there's judgments on you as in taking part in illegal activities, so there's that law, fear, there's the fear, but really, I believe underneath it all is that fear of being judged, right? And then immediately labeled for life, either like whether you recover or not. It's like, you're always the ex-addict, or you're the person who, dared to admit it. And when you frame it in such a way, like when Gabor framed addiction in a broader definition, we realize, we're all in this, we're all on some spectrum, right? And it brings us together. And I think that kind of thinking is what's going to lead to people feeling more comfortable being open, more comfortable sharing, and not being afraid. Yeah, and keeping a secret is hard work. It's really hard on you. It's hard on your relationships. It was hard on my relationship with my friends, with our mutual friends, with my parents, with his mom. And yeah, it causes so much more unnecessary strain on an already stressful situation. So, yeah.
Jaeun, the question of secrets?
Yeah, I think I agree. It's like, it's about, I think, opening the conversation up and making people, or helping people to understand that the kind of responses that we have to pain are not pathological or wrong or deranged in some way, but that that these are natural responses to situations that occur. And that I think we all agree that everyone wants to be happy and everyone wants to avoid pain. I mean, those are common human qualities. And most of what we do, I would argue, in our lives is response to that we're trying to hold on to what makes us feel better and we're trying to get rid of what makes us feel bad. And we don't always necessarily find the healthiest ways to cope with those things, but to understand that underlying it is just a common human need that we have. And I think, like what Gabor has been talking about, is just broadening our understanding so that we're not misunderstanding the things that we see. And understanding always, I think, is where we need to go with things like this, and education, and just making it part of our conversations that we have. And that, I think, also requires us as individuals and as care providers to acknowledge that we too are wounded.
We have some masks to take off, it sounds like.
Absolutely.
So when I worked in the downtown east side, my clients would be shooting heroin and cocaine and whatever else they were doing. And I'd be spending thousands of dollars, sometimes a day, on classical music, which is my addiction. And I would lie to my wife and ignore my kids and even be derelict on the job when I was pursuing my compulsion. What's interesting is that when I told some people read my book on addiction, I think, how can you compare your classical music addiction to heroin? I said, I'm not comparing it, I'm just showing the similarities. But when I told my clients in the downtown east side, the heroin shooters, I said, I've lied and cheated myself. In fact, I've done it just yesterday. They shake their heads and they smile and they say, Doc, I get it. You're just like the rest of us. And the point is that we're all just like the rest of us. And so the point is to acknowledge that openly, so that when you acknowledge, and I talk about this very freely, the reason I talk about it openly is because I'm not ashamed of it. And the reason I'm not ashamed of it, because I know that it was a wounded part of me doing that. I was unconscious. Why would I be ashamed of something that my unconscious ego does? It's not personal. It's not that I don't have responsibility, but at the same time, there's no shame around it once you understand it. And the real issue around secrecy is the question of shame. So the more we can be open about our own stuff, the less other people will feel shamed around us, the more encouraged they'll be to be honest with themselves. And the more we deal with our own stuff, the less ashamed we will be, and the more openly we can all speak about it. So the thing is to address the issue of shame, and the issue of shame is that none of this is personal to us, none of this is a result of conscious decisions, none of this is something that makes us anything less than human.
Thank you. Last question.
Thanks very much for everything you've shared this morning. I've been very impacted by it. I just joined Fraser Health about 3.5 weeks ago, and
This young man just joined Fraser Health 3.5 weeks ago. Okay.
Okay, that's okay, you'll get over it.
And so I've joined the organization as an innovation leader, and it's a very exciting role, but one I certainly have fears and anxieties around as well. My question for you is, with this word innovation, where do you see a deep need for innovation in healthcare, or Fraser Health in particular? Where do you see a deep need for it?
Can I ask you a question?
Yeah.
What do you think I'll say to that? Based on what you've heard me say already.
Well, ACEs or training.
Yeah, and a shift of paradigm. A shifting of perspective from blaming people for behaviors or for pathologizing them and thinking it's all about their diagnosis, but to recognizing that it's all about their life experience and their wounds. That's the shift of paradigm that needs to happen. So you got that, thank you. So that's my answer.
Okay. The others?
Yeah, I think I agree with that. I don't work with Fraser Health, so this is my very first time to come together with people from Fraser Health. I work for Alberta Health Services, so we've got our own challenges and probably very similar challenges. And I think, yeah, that kind of paradigm shift, I think, is that you're talking about is, I can't think of anything more important than that, is to acknowledge that addiction is not a lifestyle choice. And I was talking with somebody during one of the breaks and saying that, people have cancer and they're not coping well with their diagnoses, and we see this all the time in the acute care hospitals. And those very people that are not coping well are the people that are having those kinds of illnesses because of the experiences that they've had. And so, of course, they're not coping well, and of course, they're sick. Right? So just really not taking away this culture of blame and shame and really replacing it with a culture of understanding. That's what we need, I think, the most.
Brooke, it's kind of perfect that we end with you.
Oh, geez, perfect. Nobody's perfect. I would say for me, as someone working in the research department, I'm heavily involved in looking up articles and doing literature searches for people, and also pairing that with my experience and my late husband's experience. We need innovation in listening and being truly curious with each other, because we all bring so much to this, but because we all bring so much to it, we tend to have our own agendas and our own deliverables and plans. And even when I go to do a literature search for a physician, for a nurse, for a healthcare worker, you find even in the so-called the literature that we're pulling our resources from, there's that bias, there's that predisposed notion of here's what we believe to be true and here's what we're going to publish more on, rather than publishing negative results or showing the way something works or doesn't work. And there's a real lack, surprisingly, of curiosity even in the field of research. It's more about confirming what we know to what we hold true and what we hold close to us, and not stepping out and thinking what else is possible? What other perspectives are there? How much do I value those? And it's a challenge, but it's worth really fighting for being curious and inquisitive and really listening when you ask those questions.
Kathy, let me
Thank
say
you.
one more thing.
Yes.
I'll take the risk of seeming self-serving, and I've written this stuff up. I mean, what I talked about today, it's not in the least controversial when it comes to the scientific literature. And so my books are out there. I invite you to check them out, whether on addiction or whether on relationship with stress and health and early negative experiences to cancer. And also my work is freely available on YouTube. Lots of my talks are available. Lots of people watch them. If you're interested in the broader paradigm, which is completely impossible to convey in a brief talk, there's my work and the work of others that's freely available on YouTube and online. So I just invite you to really educate yourself with the kind of curiosity that Brooke was just talking about.
Okay. Thank you for the question. And thank you, all of you, our panelists this morning. Thank you.
Thank you.